Welcome to the Love and Guts podcast. Today I have Dr. Eric Osansky on the cast with me. I'm going to read his bio because I haven't retained all that information, having two kids with no sleep. So Dr. Eric Osansky is a functional medicine practitioner with over 15 years of experience in chiropractic care, nutrition, and natural approaches to thyroid health. After overcoming Graves' disease and achieving remission in 2009, he committed his career to helping others heal from thyroid and autoimmune conditions through holistic, evidence-based strategies. He is the author of Natural Treatment Solutions for Hypothyroidism and Graves' disease, Hashimoto's triggers, and the Hypothyroid Healing Diet. As host of the Save My Thyroid podcast, Dr. Osansky shares practical tools and expert insights to guide listeners on their healing journey. Dr. Osansky holds a master's degree in human nutrition and functional medicine and is board certified as a clinical nutritionist and certified nutrition specialist. He is also trained in herbal therapy and stays current in the field through ongoing education, conferences, and advanced coursework. So in this episode, we cover what inspired Dr. Eric's focus on thyroid health, were there personal or professional turning points? How does gut-thyroid communication present in clinical practice, and what are the early signs that suggest thyroid issues originate from the gut? How do intestinal permeability and dysbiosis affect autoimmune thyroid disease, like Hashimoto's? Sorry, I can hear my children in the background. Are there common microbial triggers? We talk about SIBO and hypothyroidism and how they often co-occur. And does one drive the other? How does Dr. Eric prioritize treatment? What functional tests does he use to evaluate the gut-thyroid connection? How do nutrient deficiencies caused by poor gut absorption, such as selenium, zinc, and iron, impact thyroid hormone production and conversion? And what interventions have been most effective in improving thyroid patient outcomes, including Dr. Eric's own experience, and we get into so much more. Welcome to the Love and Guts podcast, Eric. Dr. Osansky or Eric, what do you prefer to be called?
Oh, whatever you prefer. Not Dr. Osansky. So yeah, Eric, I guess, is fine.
Or Dr. Eric. Dr. Eric.
Yeah,
Okay.
Dr. Eric works.
Excellent. Well, welcome to Love and Guts. I'm excited to have you on discussing this conversation all about the connection between the thyroid and the gut. But I do want to get into what initially drew you to focus on thyroid health specifically. Like, was there a personal or professional turning point that led you down the path?
Yeah, I have a personal journey, or had a personal journey with Graves' disease. Back in 2008 is when I was diagnosed initially with hyperthyroidism, and then saw an endocrinologist and got that official Graves' disease diagnosis. And at the time, I mean, my background's a chiropractor, and up until that point, I really didn't have much experience with thyroid and autoimmune thyroid conditions, let alone Graves. But I did attend some functional endocrinology seminars as part of my continuing education credit. So I did know that there were natural options out there. And so when I was diagnosed and the option presented to me, or presented with, it was anti-thyroid medication. Many are also told to get either radioactive iodine thyroid surgery. With me, thankfully, it was just the medication, but I actually held off on the meds, took an herbal approach to manage the symptoms, and did other things to restore my health. And since 2009, I've been in remission and or cured, depending on how you want to label it, but whether I'm cured or in remission. But either way, I've been doing really well since 2009, so 15 plus years, and since then helping others with thyroid and autoimmune thyroid conditions.
And you've written about three books and have a
Yeah,
podcast on the topic.
exactly. Yes.
That's how
Yes.
inspired you were to help others.
Yes, definitely. Just felt the need to spread the word. And I mean, I focus more on hyperthyroidism and Graves just because that's my personal journey. And then there's not as many practitioners who focus on that. Most of them
Yes.
out there focus more on hypothyroidism and Hashimoto's.
That's true. That's true.
Yeah.
And so we often hear about that bidirectional communication between the gut and the thyroid. In clinical practice, what are some of the first signs that thyroid dysfunction might actually be rooted in the gut?
Yeah, well, I guess first of all, as we both know, it's entirely possible for someone with a thyroid condition to have digestive issues that are not related to the thyroid condition. So they're not always intertwined, but I guess a few things to look at. Uh, some of the conversion, even though most of the conversion of T4 to T3 takes place in the liver, some of it does take place in the gut. So, where T4 converts to T3. So, if someone has normal T4, lower T3 levels, that again, the challenge is we can't differentiate just by looking at that. It can say, is it a conversion problem in the liver? Is it an issue with the gut or other location? But that might be one thing we look at. Um, but we also know that most thyroid conditions are autoimmune in nature. Again, my experience with hyperthyroidism, which again, most hyperthyroid conditions are Graves, most hypothyroid conditions are Hashimoto's, and most of the immune system cells are located in the gut. And so, just if someone does have an autoimmune condition like Graves or Hashimoto's, typically there is going to be a gut component. But then on top of that, if we do see like certain patterns, like, let's say H. pylori present or Yersinia enterocolitica, in combination with that thyroid dysfunction, then there's also a decent chance that there's that relationship as well, which we could definitely talk more about.
Yeah, please do. And look, we definitely want to get into the H. pylori aspect of it. But in your experience, what red flags in patients' gut health make you immediately consider testing thyroid function or vice versa?
Yeah, I mean, if someone well, again, I mentioned H. pylori, so definitely if
Yes,
someone's having like heartburn or reflux, then
burping.
yeah, exactly. And I mean bloating, gas, which could relate to other conditions, including SIBO, which you're very knowledgeable in and an expert in, and again, that's more closely associated with hypothyroidism. But you'd be surprised how many people with hyperthyroidism and Graves also have SIBO too. Doesn't mean that that the hyper is necessarily causing the SIBO or vice versa, but uh, again, we definitely could talk about that as well. But yeah, any type of digestive symptoms, obviously, I'm going to suspect some type of digestive issue. Now, it might just be as simple as the person needs to change their diet. We're not going to automatically jump to H. pylori, and if someone's having certain symptoms, we'll be like, well, are you eating a whole healthy foods diet, avoiding the common allergens like gluten and dairy? And if the answer to that is no, then we're going to obviously recommend to make those changes. And that's also something worth mentioning too when talk about the gut and thyroid, that conditions such as celiac disease are also more highly prevalent in those with Graves and Hashimoto's, not just based on my experience, but just if you dive into the literature, you'll see that connection.
Mm. And what is the connection there? Did you want to discuss that a little bit more? And also maybe explain how intestinal permeability or dysbiosis can influence autoimmune thyroid conditions like Hashimoto's.
Yeah, so let's talk first about, or let's tie it into what's called the triad of autoimmunity, or the three-legged stool of autoimmunity. And according to this triad, there are three components necessary for autoimmune conditions like Hashimoto's and Graves to develop. So one is that genetic predisposition, which obviously we can't change the genetics. We can modify the expression of genes through diet and lifestyle, but the genes we have are the genes we have. Then there's exposure, the second component, exposure to one or more environmental triggers, such as, again, food triggers, such as gluten, even stress could be potentially a trigger, and then environmental toxins, intoxicants, infections. And then there's three, that increase in intestinal permeability, that disrupted intestinal barrier. So that also is part of that three-legged stool of autoimmunity. And so when you have that leaky gut, that allows larger proteins and toxins and other things to get through that normally shouldn't pass through that intestinal barrier, and that causes an immune system response. And when you have that immune system response in combination with the other two factors in that triad, that genetic predisposition along with one or more environmental triggers, that's likely to lead to the development of auto antibodies and that autoimmune process that ends. As far as whether someone develops Graves or Hashimoto's or the antibodies for both, I mean, that's where the genetics come in. That's where the honest answer is I don't know, because that's a common question. Like, how do we know, like, if someone is going to develop Graves or Hashimoto's, or again, a lot of people do have antibodies for both, and it does there does seem to be that genetic factor when it comes to what autoimmune condition someone develop.
And are there any specific microbial patterns that you see, say when you're doing a gut microbiome test, for example, in that sort of subset of people that potentially could have thyroid concerns?
There are microbial patterns. Now, whether or not the challenge is I only see people with Graves and Hashimoto, like thyroid and autoimmune thyroid conditions. So
Yes.
it'd be
So let's speak to
interesting.
that.
Yeah. So, I mean, I see, again, I mentioned H. pylori, which is
Yes.
pretty common. Um, and then, I mean, there's always going to be some type of dysbiosis. Like if I do a test, let's say like the GI map, for example, I'll usually see opportunistic bacteria such as Streptococcus, Staphylococcus. Again, I don't think those are specific triggers, but I think those are more incidental findings, but they are quite common. Uh, Very common to see low pancreatic elastase. Um, Sometimes we see high calprotectin. I can say that's again something I see with most people, but the low pancreatic elastase, I'd say like 70 to 80% is either less than optimal or overtly low. And usually we do see the normal flora on the lower side, although the phyla varies. Like sometimes we'll see the Firmicutes and Bacteroides on the higher side, sometimes on the lower. So I can't say I see any consistent pattern with the phyla. Again, even the flora, like Akkermansia, is commonly low, more so than it is high, at least in the my Graves patients. But yeah, those are some of the common patterns. Again, there are others that we see like, like Klebsiella and Pseudomonas. But again, I can't say that like 70, 80% of those with
Yes.
Graves or Hashimoto's have those findings. I wouldn't even say like 30, 40%. I'd say, again, maybe like 5,
May.
10%, which means not necessarily directly correlated, in my opinion.
Yeah. And I'd love to speak to the SIBO and the Helicobacter pylori infection aspect of it. So there's emerging evidence of an association between H. pylori and the autoimmune thyroid disorders, so potentially via immune cross reactivity. Do you want to speak to that a little bit?
Yeah, the research definitely shows that relationship with both Graves and Hashimoto's that as you mentioned, where H. pylori can affect the immune system and be at least a contributing factor, if not a direct trigger. And I will say over the years, and there's definitely controversy when it comes to H. pylori. And I know on your podcast, you've had Dr. Jason Horlek on there, and I've had him on mine. And when it comes to not only H. pylori, but parasites, I know some will say, well, you don't always want to eradicate them, but
Yes.
I'm not saying you should always eradicate them, but if I see H. pylori in a Graves patient or a Hashimoto's patient, even in the lack of symptoms, I will recommend to treat it. Not necessarily antibiotics, but with herbs, try to take a natural approach whenever possible, just because it can be a factor in that autoimmune process. And I've seen in my practice where patients have gone into remission when that's been like the main focus. Now we're always going to be doing other things too, like telling people to clean up their diet, manage their stress. So everybody's going to incorporate foundations. So sometimes it could be challenging to know for sure, was it H. pylori or was it, the foundations that people incorporated. Um, but again, I think as long as we're taking a natural approach and not giving everybody like triple antibiotics or, triple therapy, the two antibiotics and the PPI, I think, at least in my opinion, what I've seen, people are fine. We're not like disrupting the gut microbiome and like retesting a GI map, we're not seeing a lot more dysbiosis when the H. pylori is negative. So, but yeah, that is something that for years I've been recommending pretty much to all my autoimmune thyroid patients to test for H. pylori, even if someone's not experiencing symptoms.
And what are some, you mentioned treating H. pylori. What are some common things you're using? And this is just, obviously it's case by case, but what are some common things you find yourself using to eradicate H. pylori?
Yeah, it's a great question. And I will say I don't know if you've experienced this, if you treat H. pylori at all, but it's been more difficult. I find it more difficult to eradicate over the years. So like in the past, I might have just recommended like mastic gum and maybe black cumin, and that seemed to be enough. And then just for whatever reason, and it's not just me, but other practitioners who treat H. pylori also seem to share that sentiment. So I had Dr. Nicholas Hedberg on the podcast a few years ago, and he spoke about triple probiotic therapy, like a lactobacillus bifidobacteria probiotic, a spore-based probiotic, and Saccharomyces boulardii. And so I've used that in combination with certain antimicrobials, things like mastic gum and black cumin, DGL licorice. I mean, and if you look at the literature, there's actually a lot of things that can help with H. pylori, but
Mm.
by itself doesn't always and many times isn't sufficient. Like, for example, raw garlic. There's some studies that show that having two cloves or two cloves twice a day of raw garlic could potentially eradicate H. pylori in a week. And I've tried that on patients, and I've had some people get symptomatic relief, like decrease in symptoms, but so far haven't had anybody eradicate it. Now, not everybody's willing to eat raw garlic, so I can't say it's been a large sample size of hundreds of people. But again, if someone's willing to do that in combination with some of the natural approaches I just mentioned, that it's definitely not going to hurt. Even just eating fermented foods along with the probiotics. Of course, you want to try to do as much as you can through food, so that could be uh, also effective. But again, by itself, any of these treatment options by itself doesn't seem to be as effective. Everybody's different, and some people they might just respond to one or two herbs or just a triple probiotics alone. But I find that even after a couple of months, if we're just given like triple probiotic therapy or just like mastic gum and black cumin, just usually it's not enough.
Yeah, it is a tricky one, isn't it? And I know that this is a bit of a supportive. It's not just the one thing that's going to eradicate, but I know that there was even some information around 2 glasses of carrot juice daily
Hmm.
for a number of months. So little things like that that people can incorporate easily into their diet can be really supportive too. Um, I'll see if I can find that information to attach on the show notes. And I even think cranberry juice was a part of that as well, cranberry and carrot. But it is a tricky one. When it comes to SIBO and hypothyroidism are frequently comorbid. Do you believe one drives the other? And how do you approach treatment sequencing when both are present? And I guess that even goes with H. pylori. Like, which one do you start with? Or do you start with both? Or like, how do we approach this? How do you approach it
Yeah,
when it
I
comes
guess
to
we could
SIBO?
fin yeah. Well, I guess since we are talking about H. pylori, we could finish up with that and then jump to SIBO. I mean, H.
Sorry, that's
pylori.
how my head works at 6:30.
No,
50
that's okay.
questions in the one.
Yeah, I mean, H. pylori, it's a little bit different. Like I'll treat H. pylori um, like if someone has hypo or hyperthyroidism, of course we're gonna want to do things to manage the symptoms while addressing the cause of the problem. So, but yeah, like once we treat for H. pylori, oh, I'm sorry, once we test for H. pylori, and then if someone's positive, we're gonna put them on a protocol for H. pylori. And then, I mean, we're still going to do things for the thyroid if someone needs thyroid hormone replacement or anti-thyroid meds or natural agents like bugleweed. Again, we could definitely do that at the same time. So there's not like an order where we have to get rid of the H. pylori and then address the thyroid. But with SIBO, it's an interesting question because so hypothyroidism definitely could affect motility and could
Yes.
affect the migrating motor complex. And so if someone has overtly low thyroid hormone levels, that could cause SIBO. I mean, I guess even subclinical hypothyroidism could be a factor, but definitely would be more of a concern when thyroid hormone levels are really low. And so if that's the case, then we obviously would want to address the thyroid, like, and again, not to say we can't do both at the same time, but we wouldn't want to put someone on a protocol for SIBO and not do anything for the thyroid if the
Yeah.
thyroid potentially is the cause of the SIBO. And yeah, I mean, there could be other causes I mean, just because someone has, let's say, Hashimoto's and SIBO doesn't mean that the lower thyroid hormone is responsible for the SIBO. Maybe there's something else causing it, like again, the food poisoning that could damage the migrating motor complex. And maybe that person had SIBO for a long time, even prior to the Hashimoto's diagnosis, for example. But if we know or if we're strongly suspecting that the low thyroid is the cause of the SIBO, then yeah, we would want to address maybe have the person take thyroid hormone replacement. If it's Hashimoto's, obviously we want to address the autoimmune components and not just only have the person take thyroid hormone. But once the thyroid is managed, once the thyroid hormones are in balance, then yeah, we would want to address the SIBO. And I mean, you're the expert. I know there's three main ways with the herbs, the antibiotics, the elemental diet. So whichever one, and maybe there's other ones, but those are the ones I'm familiar with. So regardless of the approach, yeah, you definitely want to, in the case of hypothyroidism, affect, I mean, address the thyroid before SIBO. Now, what hyperthyroidism I mentioned earlier, I think maybe it was before we press record, that it's actually not uncommon to have hyperthyroidism and SIBO, but I don't think it's the hyperthyroidism that's actually causing SIBO. So if someone has both of those, like again, I don't, I mean, we would want to manage the hyperthyroidism for other reasons because we want them to be safe and not go into like a thyroid storm. But in this situation, it's not as urgent for the sake of address. Like we could just jump right into addressing SIBO in someone
Mm.
who has Graves' disease, for example.
And you mentioned a couple of things there and how the thyroid can impact certain things that can contribute to SIBO, like the slow motility and impact the migrating motor complex. And for those that may not be aware of those things and how they can drive, it can just really set up that environment to not clear out bacteria in the small intestine. Um, so it just makes it a bit more attractive for those that overgrowth to occur. But there's also things like absolutely, we got to address the thyroid because it is a driver. It can be a driver of SIBO, but there's also stuff we can do alongside. There's simple things we can do to support motility um, outside of the thyroid concerns that are driving that motility. There's things that we can already start with, like the partially hydrolyzed guar gum and certain herbs to support motility too. So yeah, I think that you do want to address, like you said, the thyroid first, but like we can get started on the gut microbiome motility support straight away, can't we?
Yeah,
So there's
definitely.
we're not kind of leaving that um, compartmentalized and not looking at the supporting the gut while we're working on the thyroid. We can do certain things together. We may not just go in with certain antimicrobials straight away, or for some they may do it all, who knows. You definitely want to address the drivers, absolutely. So
Agreed.
you've already mentioned, we've already spoken about how T3 can impact gut motility um, and transit time. So I just want to, God, there's so many questions here. Really being from a functional testing perspective, what are your go-to assessments to explore the gut-thyroid connection, and how do they inform your clinical decision making?
Yeah, good question. So, I mean, of course, we do want to, goes without saying, look at the thyroid too. So, beyond the functional medicine testing, we want to make sure we do a full thyroid panel. Most medical doctors, including endocrinologists, a lot of them will just look at the thyroid itself. Some of them will just look at TSH, thyroid
Yes.
stimulating hormone. Some of them just TSH, T4. But again, since most thyroid conditions are autoimmune, we do want to look at the different antibodies. And so if we see negative antibodies, it doesn't mean someone won't necessarily have a gut issue. But if we see those autoantibodies, like I said, there's that triad of autoimmunity, which suggests that there is a gut component. So testing the antibodies are important. And and when it comes to functional medicine testing, comprehensive stool tests could definitely be helpful. I mean, we could test H. pylori, of course, by itself as well. You could do like a stool antigen test or a urea blood test. Uh, you don't want to do blood testing because it's looking more at antibodies, and especially if you're retesting H. pylori, you definitely don't want to do a blood test. But typically, I'll recommend stool. The tests like the GI map will already have H. pylori. GI effects from like Genova I think it's an add-on to do H. pylori. So if you do those tests, you could look at H. pylori in the stool those ways, and then also they look at parasites, which not perfect. The challenge with these stool tests is if the parasites are present, then they're present, then they're there, then they're there. If it's negative, you can have false negative parasites.
Mhm.
Uh, and then it looks at other markers too. But to get to the question you were asking as far as the test, so comprehensive stool test.
Yes.
If someone's having a lot of bloating, gas, and if it's not resolved by food, again, we'll want to see does dietary changes, like is it are high FODMAP foods causing problems, and if so, then maybe we're looking at SIBO, doing like a SIBO blood test, and I mean, when it comes to like yeast candida, I do like organic acids testing, but it depends. I'm not going to necessarily have everybody do all those tests. Like
Yes.
sometimes stool testing, I find doesn't do a great job of picking up yeast. But if we do, let's say if we start off with a stool test, and if there is yeast that's present, then we probably wouldn't need to do organic acid test, at least to look specifically at yeast. Um, mold, speaking of yeast, which is a fungi, and then mold's a fungi, and sometimes molds can also colonize the gut. So doing either a home test for mold or a urinary mycotoxins test. And again, that's what we use also the health history for. I mean, there's some people that will do these tests on every single person. I can't say I do all these tests. Again, I usually use the health history to guide which of these tests to do.
And it sounds like it's the gut microbiome test for us. I mean, I tend to use the shotgun metagenomics. I don't think is uses that method, but also hearing that it's the gut microbiome stuff as well as the thyroid panel that's like the top tier, and then the others obviously case by case. Even would you find like a intestinal permeability test, like the lactulose and mannitol test, be useful at some point, maybe further down the track?
Maybe it's a
You
good,
can go nuts with testing, can't you? But you really got to be discerning because it can cost the patient, can't it? And so you just
yeah. And that's the thing. I didn't do lactal, I mean, I've done it before, recommended before, but I used to do a lot of Cyrix labs. If you're familiar with, they have their array number two, which is their intestinal antigenic permeability test. So it looks at the immune system response, more like antibodies to occludin, to zonulin, actomycin, LPS. And so I did that years ago on a lot of patients. And I did find that most people who did the test were positive. But then, yeah, I started reevaluating and thinking, should I have people spend a couple of $100s on this test when it's not telling us what's causing a leaky gut? And
yeah.
then, yeah, and so over the years, more recently, I just assumed that people have a leaky gut rather than to have everybody test for it. But it's a good question. If you're going to do it, maybe rather than doing it initially, I think you mentioned maybe doing it like towards the end, just if you want to confirm that you don't have a leaky gut. Because the thing is, if you do it initially and you show you have a leaky gut, then you're probably going to want to do it again later on
Yeah.
to check and make sure.
See
Um,
how treatment's going and
yeah,
see the progress.
e-
Yeah, and
exactly.
I think the benefits in this scenario, I would probably be starting with like probably yourself, like the thyroid panel, including the antibodies, and definitely gut microbiome test. But the leaky gut, I mean, in perfect world, I'd get that done as well. But eventually down the track, I'd probably look at doing that only because I think if we're dosing so highly with things like glutamine, we may not need to be using certain supplements if that intestinal permeability is not present. Sometimes we
Mhm.
can just assume it's there, but it may not be. And if you're doing 15, 20 grams of glutamine a day to really support leaky gut when they don't need to, I'm like, oh,
Yeah.
sometimes that
That
information can be really useful, versus just throwing things at it. But in this instance, I'd probably start with those two as well. Interesting, because I'm curious about, excuse my ignorance, in the States, we have that issue too with generally TSH will just be tested here or T4, like you said. Often if the general practitioner doesn't do the antibodies, we will go externally. There's
Mhm.
certain companies online like iScreen and various other labs that like Naturopath or many other labs there that do T4 antibodies or the T3, all those sorts of things. So we often need to go externally. Is that what you guys need to do as well? Do you have external platforms that you use to test for the antibodies, T4, T3, reverse T3 for some?
We do. Yeah. So without question, you're right. If an endocrinologist, for example, is refusing to test the antibodies, then we'll definitely ask the patient to test them on their own.
Yeah,
So,
out of
so
pocket expense. Yeah,
exactly. Yes.
yeah. Um,
Yeah.
how do nutrient deficiencies secondary to poor gut absorption, such as selenium, zinc, iron, impact thyroid hormone synthesis and conversion? And are you testing for those nutrients too? Or do you just look at thyroid antibodies are elevated here, T4, T3 is low or elevated, and then just using particular nutrients to support that pattern?
Yeah, I mean, it's more of the latter, honestly. I can't say I test everybody
Yeah.
for all the
Yeah.
nutrients. But I mean, you do bring up a good point that the gut obviously is important for nutrient digestion and absorption. So if you have some malabsorption issues, whether it's SIBO or something else going on, or even H. pylori that affects stomach acid production, and we know healthy stomach acid is important for the breakdown of minerals. So, so yeah, that could affect these mineral like iodine, which is controversial in the worlds of thyroid health, because it's important for thyroid hormone production. We know
Yes.
that, but then if you take too much iodine, that could also be problematic as well.
Mm.
And uh, and I used to
Like a
do a lot
little
of t
orchestra, isn't it? You just got to be so,
it is,
and you got to keep
yeah,
checking in and seeing, okay, how are we going with that iodine use? Do we need to back off? Do we need to, like, it's so fine tuned. Anyway, sorry to
yeah.
interrupt.
No, no, that's okay. And then yeah, selenium. I mean, so much research with selenium, and it's not just directly thyroid, but thyroid autoimmunity, how it could help with the immune
Mm.
system and reduce oxidative stress. And iron is very important when it comes to so iron is one that I test everybody. So that is one. Yeah, I can't say I test all the nutrients. Iron is one that I do because a lot of people are deficient in iron, but you could also have too much iron, and so you wouldn't want to just supplements and assume that someone is
Yes.
iron deficient. So I always do run a full iron panel on everybody, and then if it's low, I mean, of course, we want to try to address the cause of the problem, or, I mean, it's not always gut related. Maybe we're working with a cycling woman and that she has a heavy menstrual flow, and that's playing a role in it. But if I'm working with a male or a woman in postmenopause and all the iron markers, the ferritin, iron saturation, iron is low, then yeah, I might be thinking, well, is there something going on with the gut in that situation? And then, yeah, they might need to supplement with iron, but also try to address the cause of the gut problem. Is it H. pylori again, or is there something else? So iron is definitely one that I look at, like I said, in pretty much everybody.
Mm. And in terms of like patient outcomes, have you seen cases where resolving gut dysfunction led to like measurable improvements in thyroid markers or a reduction in autoimmune antibodies?
Yeah, I mean, without question, I think if you ask most functional medicine practitioners who work with autoimmune patients, they'll see that relationship by doing things to support the gut, to heal the gut, to address triggers like not just infections, but again, gluten could affect that permeability. So in many cases, just eliminating gluten can
Yeah.
have a dramatic impact on gut health. And maybe not in most people alone will restore their health, but in some cases, we know in celiac disease that's definitely the case, which
Mm.
we mentioned a little bit earlier. Um, but yeah, just by removing the trigger or triggers that are affecting the gut, whether it's a food or infections or, again, environmental toxins. We haven't really spoken about this, but there's, these endocrine disruptors that affect the thyroid also affect the permeability of the gut, can cause dysbiosis. Mycotoxins also could affect the gut. We know that glyphosate can affect the gut. Is glyphosate an issue
Yes.
in Australia as well? Okay, so
Yeah.
yeah. Yeah, so I know in Europe I've had some others where, so I guess everywhere glyphosate is an issue. But yeah, all these environmental chemicals. So without question, I've seen where we addressed, and in the case of chemicals, obviously we're not going to completely eliminate them, but at least reducing one's toxic burden,
Yeah.
addressing the H. pylori or whatever infection they have, having them cut out common allergens that will affect the health of the gut. Yeah, it's pretty common to see changes. Now, again, that being said, we're doing other things too, like people are addressing stress management, like we're doing things for adrenal support, and again, reducing toxic burden isn't only about affecting the gut, like the things that could affect the gut, but they affect other areas of the body, affects the immune system directly. So, but yeah, I mean, I think if we didn't do anything to help support the gut, at this point I probably would be out of business because
Yeah.
people wouldn't be getting the results that they have been getting for years.
And what do you think? Like you've mentioned it, like quite a lot of things there, which is great. And I love that you've mentioned lowering your toxic burden. I think it's so important for all of us, really, but particularly when it comes to thyroid health and supporting thyroid function. What was the one of the I'm sure there was many. What were a few things that really moved the needle for you with your thyroid health and helping
You mean
you
just
get to that
you mean
remission, for want of a better way of saying it, with your hypothyroidism, your
Yeah, I mean definitely with me a big thing was stress. So stress also does affect the gut too. So like one
100%.
thing. Yeah, because when I dealt with Graves, I was in denial that stress was not that it wasn't a factor, but that it was affecting me. But then I did an adrenal saliva test, and so everything was low. Cortisol was low, DHEA low, and secretory IgA was low, which that lines the mucosal surfaces of the body, including the gastrointestinal tract. And and then so I supported my adrenals, blocked out time for stress management. I also should mention I was overtraining prior to my diagnosis, so that's a stressor on the body. So I, of course, stopped overtraining. And when I did a retest on my adrenal saliva test, cortisol was looking much better, DHA was much better, but secretory IgA was not better. It was still like really, really low. And I'm like, well, maybe it's just taking more time to do this. But one thing I decided to do was eliminate nuts and seeds at the time. I was eating them, and part
That
of
autoimmune
like,
picture.
yeah, exactly. Like in 2009 or 2008, 2009, there wasn't like AIP diet and all that. I mean, there were like gut healing diets and variations, but I was following more of like a regular paleo diet. So I was
Mm.
eating nuts and seeds. And when I took a break, maybe it was coincidental, but I took a break from the nuts and seeds for a few months, retested my secretory IgA, and it normalized. Now, again, maybe it would have normalized anyway with more time spent on the stress management, but it was just interesting that taking a break from those because again, they're healthy foods, but
Absolutely.
in some people they could be a little bit harsh when trying to heal the gut too. So but yeah, without question, the stress I think was a big factor in my situation when it with deal with Graves.
Couple of things there. I am writing notes. I'm not being rude. I just things
No, that's
pop up,
okay.
and I'm like, oh, nuts, oh, stress. So where are you at with the nuts now? Do you incorporate nuts um,
I do. Yeah,
now, or
I
do
can.
you sort of back off completely? Because as you said, they are good foods. They're a great source of prebiotic fibers for some.
Yeah, no, I'm laughing because I do, but again, they could be addicting too. Like, I could
Oh
have like a
yes.
bag of pistachios and like before you know it, just like I'm
Oh,
eating
tell me
like
about
two
it.
minutes. Yeah. So I eat them, but I still try to limit them. And so and just meaning that portion size. Like
Yeah,
so
yeah.
I can't say I eat like unlimited amount, but yeah, I'll eat
They're in your
pistachios,
diet.
I'll eat like macadamians. Yeah.
Beautiful. Yeah, yeah. I'm the
Yeah.
same, and you just can't have almond butter around me. It doesn't last long. And it's so, I don't know about the States, but it's so expensive here, like nut butters and stuff like that. It's just, it's an investment, which is great. Willing to invest in it, but just not
Yep.
consuming it within a day. Um, when it comes to stress management, like lots of things resonate with different people, lots of different things. What are some of the things that you tend to recommend when it comes to stress management for people? Are you recommending meditation? Are you recommending what is the breathing exercises like ice baths? I don't know. What's some things that you kind of have enjoyed yourself and you've found really easy to implement for patients as well? Because I think that, stress is a huge one.
Yeah, I agree. Yeah, I can't say the ice baths, even
Yeah.
myself.
Guess that
I've
won't
been
be
doing cold,
relaxing for most, but
yeah. Well, I've been doing cold showers and that, I
yeah.
mean, I will say once I'm done with the cold shower, I feel invigorated and,
Yes.
the benefits it has on the parasympathetic nervous system, which of course ties into the gut. So I do talk about that, but the ice bath, since I haven't been brave enough to do those, I can't say I encourage my
Beautiful.
patients to do those, but I do know the potential benefits. But what I recommend is what people are willing to do. So I first of all, I think it's important to do something every day. Just and if someone isn't in the routine of managing the stress, I'll tell them just start with 5 minutes per day, just because I don't want any excuses. Like, yeah, sure, like 15, 20 minutes a day would be great, but everybody has 5 minutes per day. And if they don't have 5 minutes per day, then they really need the
Yes,
stress
totally.
management. So 5 minutes per day, and really what the person's willing to do. If it's just deep breathing, that's great. If they want to do yoga, that's great. If they want to do meditation, that's fine. Again, really it doesn't make a difference if they want to mix it up. Maybe they go to a yoga studio 3 days a week, or do yoga from their home, but they don't want to do it every single day. So the other days they do some deep breathing. I mean that, and these days there's a lot of apps out there like the Calm app.
Yes.
There's I use Heart Math if you're familiar with Heart
Yep.
Math for like heart rate variability. Again, I can't say most of my patients use that, but I do let them know when I like send a follow up and I give them some tips when it comes to stress management, and that's one of the options. But I'd say probably most will just incorporate like deep breathing, meditation, yoga. Again, more and more people are using apps like the Calm app these days.
They're really useful, aren't they?
Yeah,
Even, just to keep it simple, and like you said, so people can't lean into their excuses. And I'm at the place too where I'm like, oh, I've got two kids, I don't have any time, da, 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 da. And I'm like, oh, it doesn't take you long to
it's
do 5 deep breaths or being in silence for 15 minutes and just sitting on a bolster or sitting on a cushion and, deep breathing. I think, you could really got to scale it back and simplify for people
exactly.
sometimes. So, what
Yeah.
are some key insights or takeaways that you'd like the healthcare practitioners to walk away with when it comes to understanding and addressing the gut thyroid connection?
Yeah, I mean, well, when it comes to practitioners, even non-practitioners, again, most thyroid conditions are autoimmune in nature. So again, gut health is extremely important, and just there. I mean, I like testing, but you need to incorporate the foundations.
Yeah.
So if you're not cleaning up your diet, if the patient's not cleaning up the diet, if they're not blocking out time for stress management, we didn't mention sleep, but the importance of sleep. I
Mm.
mean, and again, not when we talk about exercise, regular movement's important, but also making sure the person's not overtraining, because I
Yes.
think that's something since I experienced, I try to make sure that I ask, or at least get a feeling that the person's not overtraining, but some practitioners will just make sure that the person's exercising and not
Yes.
look
Not
into if they're
checking for
overtraining.
exercising.
So, and then again, just I do like testing. So, like I said, I try not to overdo it with testing, but there are some people that just guess and don't test. They just
Yes.
assume everybody has parasites or they just go by symptoms. And again, I know people have, some practitioners have success doing that. And there's flaws because, like I said, you do a stool test and it doesn't show parasites. And then again, that doesn't rule out parasites. But I do like to test because when I test, we're not just looking for parasites. We are looking at
Absolutely.
other things as well. So I recommend testing and not guessing. And and then, when someone's hitting roadblocks, it's important to consider, well, first of all, obviously patient compliance is important. Make sure they're doing what you recommended. And if they are, then what are we missing? Do we need to dig deeper, or do we just need to do a retest? Because we mentioned like earlier, like H. pylori is difficult to eradicate, so we can't just put someone on a protocol even for like let's say 2 months and assume after 2 months it's gone. So if the
Yes.
person is not where they need to be, it's same thing with SIBO. With SIBO, now SIBO usually a person will experience symptoms. But still, even with SIBO testing, ideally you want to eventually do a retest and make sure
Absolutely.
that everything looks good. So yeah, sometimes digging deeper and doing additional testing, sometimes doing retesting.
Mm. And also, I think retesting is really important because we don't want to have people on, say, antimicrobials for an extended period of time because even the natural stuff, the herbal
Yep.
antimicrobials, can have a detrimental impact on the gut microbiome. So it's not which is why testing and not guessing, like you said, is so important because we don't want to be using things unnecessarily. You really want to safeguard that terrain as much as we can. Um, but I want to
Yeah.
hear, and is there anything, I'm sure you've mentioned it, because your special area of interest is that sort of hypothyroid picture. Um, and like you said, there's more people focused on, say, the hypothyroid element. Is there anything in that department that you feel that has been a bit, not groundbreaking, but have been eye-opening for you that you feel like practitioners don't really know about or we should really, you know, consider
Yeah, with
when it
hy
comes to
with
that
with
with
hyperthyroidism, right?
hypothyroidism, since that's your kind of niche?
I wouldn't say groundbreaking. I mean, I think a lot of practitioners get overwhelmed or intimidated, maybe is a better word, like they feel more comfortable with Hashimoto's patients because it seems like it's easier to manage. And I agree, if someone comes in with a resting heart rate of 120 beats per minute, it could be intimidating.
Yeah.
Um, and you definitely want the person to either be on the antithyroid medication or some natural approaches like the Bugui that I took, the motherwort. Um, but then also with one of the common conditions with Graves is thyroid eye disease, and I think that
Mm.
scares a lot of people. Just like if someone comes in and they have like the bulging eyes, the
Yes.
swelling, and again, it's not to say that they shouldn't get evaluated by an eye specialist, an ophthalmologist. That's probably a good idea, but thyroid eye disease is also an immune system condition. So this isn't, I wouldn't say it's groundbreaking, but just a lot of practitioners don't really know or don't think about it. They just get intimidated and like, well, let's refer the person out when they could be helped by some of the things
So
we've been
much.
discussing here. And so yeah, if someone comes in with Graves, just like Hashimoto's, the symptom management aspect is going to differ, of course, but the functional medicine aspect there's going to be a lot of overlap with what we discussed with the gut. And I mean, obviously, there's differences in the motility. Usually, you're going to see the increased motility with
Mm.
hyperthyroidism, and
Yeah.
so those are things that's not a secret, and most practitioners know. So, So yeah, I wouldn't say there's really any breakthroughs. It's just trying to keep the person safe while addressing the cause of the problem. And it's unique, it's different than other autoimmune conditions, but we could say that with every autoimmune condition is different,
Mm,
like has a uniqueness about it. And I'm more comfortable working with it, of course, because I've dealt with it
lived
and just
experience.
over time been working with patients. But that, as you know, with anything, that's the only way you're going to feel comfortable is by working with people who have whatever condition you're a SIBO expert, and just that you see a lot of patients over the years, so many people with SIBO, but maybe the first time, just like when I saw my first Graves patient 15 plus years ago, I wasn't as confident as I was today. So with
Yeah, of
anything,
course.
it's yeah.
Yeah, yeah. But
Yeah,
also, what I'm hearing there is recognizing there's so much you can do. Like, yes, do due diligence and keep them safe, but there is so many fundamental things that cross over that
yeah,
that they can get started on and they can do. So
exactly.
you've got a few offerings, and I'd love for you to tell us about your books, Hypothyroidism and Graves' Disease, Hashimoto's Triggers, Hypothyroidism Healing Diet, and also your podcast, Save My Thyroid podcast. So there's lots of ways people can learn more and reach you and find you. Who were those books designed for? Practitioner, patient, both? Yeah, tell us more about those offerings.
Yeah, so Say My Thyroid is yeah, that's my podcast, and you're always welcome if you want to come on to talk about SIBO or anything else. I'd love to have you. But so Say My Thyroid, and a little bit more emphasis on hyper, but honestly, most of the information, I'd say like 80 to 90% will benefit those with hyperthyroidism and Hashimoto's. And the books are meant more for the consumer than for the practitioner, but especially with the hyperthyroid books, we do have a good amount of practitioners over the years who have read it because again, a lot of that there's not as much information out there with hyperthyroidism as there is with Hashimoto's. So if you are a practitioner listening to this, yeah, definitely feel free to check out Natural Treatment Solutions for Hyperthyroidism and Graves. Make sure you check out the third edition, which was updated in 2023, because the second edition is way back from 2013. So
Things
over the 10
changed.
years that there's been a good amount of updates. And then yeah, the hyperthyroid healing diet, which came out in 2024. And then yeah, Hashimoto's triggers. Again, I would say that book, honestly, for some people, it might be a little bit overwhelming because it's like 500 plus pages, goes into real
Mm,
detail with the triggers. So honestly, we have had feedback from practitioners too, like who loved it because I go deep into some things that might be over some people's heads. But I also have it in a way where you don't have to read it from front to back, like you can
yes.
jump around like to different chapters. And yeah, and those books you could find on Amazon. And then I have a newsletter, Healthy Gut, Healthy Thyroid, which you could check out by visiting savemythyroid.com/newsletter.
And I'll pop all of that in the show notes. And what I will say about the books, though, even if some are sort of directed at the consumer, I feel like those books are even useful for practitioners to either
Yeah.
recommend, but also sometimes it has the language to translate that information to patients a bit better because you've had it edited, you've really thought about it, you're trying to deliver that information to the consumer. So sometimes it has that language in a way that can be easily digestible to the consumer. So
Yep.
I find it useful for both, to be honest. But anywho, I can hear my husband making my children some pancake and blending away. So I better jump off. But I'm so grateful for you jumping on, Dr. Eric. It's been so insightful to have you on, and I hope you jump back on again.
Well, thank you. Thank you so much, Dr. Lindsay. I appreciate you having me.
You're very welcome. And guys, if you've enjoyed this conversation or you know someone that needs to hear the conversation that we've had, please make sure that you share this episode with them. And while you're at it, please subscribe to Love and Gut so that others can find the useful information that we've presented here today.